Hey, we're going to talk a little bit about the pulmonary, thoracic, or cardiac types of instruments. So the whole idea of these videos are just to give you some exposure to these specialty type of instruments. In a surgical tech program, typically you look at general types of trays. In this case, we're going to go over a little bit about pulmonary, thoracic, maybe some cardiac instruments. Why is that? Some of those instruments go hand in hand. Obviously the pulmonary, the lungs, cardiac system, maybe from the heart, but you're in that thoracic pleura. Let's go ahead and just jump right into that, okay? We're going to go over a little bit on just really the names, what they look like, the proper names for CST exams, but these are pulmonary or thoracic or cardiac type of instruments. There's a lot of other ones out there. This is just a brief kind of descriptions for my program that I'm in the classroom that I'm teaching, for you guys to know for quiz purposes, but maybe just out there in the world of your interest in these types of instruments. All right, starting off kind of to your left here, we're going to look at this. It's called the Lebsche knife, right? Weird pronunciation of that. Large knife, right? Has a sharp edge, kind of big handle, kind of a rasp on there. They call it a sternum knife. When you cut that sterniotomy right down the middle of the sternum for open heart, sometimes it helps access that and pull through that. It has a sharp edge. But sometimes trying to get through the ribs, they can go through that ribs too, in between that subcostal cartilage, in between the ribs. It can help by pulling up and manipulating ribs around, because ribs, when you work on that, are not very pliable in that aspect. Very large knife. How are we going to pronounce that? That is the Lebsche knife, or the Lebsche sternum type of knife. Opening up the sternotomy, especially when you're trying to make that incision, and also manipulating ribs around. Next up, they call it the Matson rib stripper or elevator, the Matson rib stripper elevator. It has a dual purpose. It has an elevator on one side and a stripper on the other. As you are trying to do thoracotomies, right, because this is a pulmonary types of instruments, right, we're trying to access the thoracic cavity. This has a design, one to elevator. What does an elevator do? Very similar to freers, Pinfields, and that kind of family. You're manipulating and elevating things around. So ribs have to be manipulated in that fashion. You could scrape off periosteum. Believe it or not, that's what that stripper on the side is, or on this side, the Matson version. Gets up on those ribs. So let's just hypothetically, that's the rib. It will scrape along, trying to get that periosteum off, because if we're going to make a resection of these ribs or cut through them, we do not want the periosteum, which is that fibrous tissue that's on the outer side of any kind of bone. The Matson rib stripper or elevator has a dual purpose. Coming over here to this spatula looking thing. No, it's not used to make eggs or flip your pancakes. It's called the Allison lung retractor. It's a non-traumatic retractor. So if you're in there and you're trying to push back lungs, manipulate lungs out of the way, if you're doing a lobe resection or a wedge resection itself, it's a non-traumatic version. You really can't miss this type of retraction device. Now this is a CST exam. They use these as lung retractors, but what do we use for a non-traumatic version of a handheld retractor? There it is. Over to a non-traumatic version of forceps or clamps is the Duvall lung forceps. Now again, when you grab onto lungs, they can be very delicate. And I like to say that lungs can be very delicate and soft and slimy, or they can be very tough. And it really kind of goes down to the pathology or what's wrong with that lung itself. Maybe there's a disease to it, tuberculosis, COPD, there's fibrous scarring tissue on there. But typically a healthy version of a lung is very slimy and delicate itself. So in order to hold on to the lungs, the Duvall is designed for that. It's a non-traumatic. Don't mistake this with the Pendleton. People get confused with that a lot of the times. But the Duvall is designed to hold on to lungs and as you're manipulating lungs and to grasp onto that. If you're doing a lobe, a wedge resection in any kind of aspect, or even a total lung removal. But I look at it as it's a grasping and holding type of forceps, but it's a non-traumatic. Let's jump over to a kind of more traumatic type of clamp that we grasp onto is the Sarot bronchus clamp. Now this is designed to hold on to the bronchus itself if we're removing the lungs or part of the lungs. But also can mean, obviously you look at those teeth on there. Yeah, it's a traumatic version of this. So you have to remember that this is traumatic. Let me zoom out a little bit. This is a traumatic version. Designed to grab, if you look in books, it just grabs right onto the bronchus because that is very tough. And if we're resecting the lobe out or the lung itself, it's going to separate those bronchus from those regions. Obviously it's right at the hilum. That's where the entry into the actual, through the bronchus goes through. This is going to grasp onto that. But if the lungs are tough, and they can be tough, you know, smokers, you know, fibrous, a lot of disease that causes the lungs to become scarred, opposed to our more delicate types of tissue, it can be tough also. So this is a good example to hold on to something. The clamp is not going to let go, right? Whatever the case we're doing, whatever the procedure we're doing. Going back over to the next one here is kind of a stripper in itself, just like the Matson stripper, which is over here. This is called a Doyen Rib Raspatory. Sounds like the Three Musketeers. No, it's a stripper of periosteum. It's very sharp. Maybe not this one because this is an example of one. They come in, they call it pigtails. It looks like a little pig's tail. But they go around a rib, and again, we're stripping off periosteum. Come on the top, strip off the top, go around, kind of circumference around it. Again, when you're resecting ribs, we don't want that periosteum on there. Just like if you're doing an amputation, you use a Cobb elevator, periosteal elevator. These are designed to kind of go around the ribs and scrape that periosteums off. CST exam will ask the Doyen, that's kind of a common thing. Doyen in this case is a Doyen Rib Raspatory, right? They scrape off the periosteum. Going to this big bad boy retractor here, right? How do we pronounce this name? It's not cappuccino. It's a Finochietto. No, it's Finochietto. It's definitely Italian. Let's put it that way. It's a rib spreader, right? Can you name the case we're going to do with this? Or name the case that we use this in, right? Open heart surgery can use that, right? We do a midline sternotomy, right? We use that sternotomy saw, and even that Lebsche knife type of thing. We can access the sternum. This is a self-retaining type of retracting device, and as you can see, it has a clamping device. It's going to hold the sternum open for an open heart surgery. So cardiac, this falls into most likely. But you can also use them for a thoracotomy. If you're a lateral position and you have access to the sides, anterior, posterior approach, this also can hold that incision site open that way, okay? So the Finochietto, cappuccino, we can mispronounce that in 15 different ways, but it's the main rib retractor we're going to use for open hearts, and also maybe for a thoracotomy for the pulmonary surgery to access the sides, right? Here's another example of them too. It's called the Beaufort type of rib spreader itself. Very similar to the Finochietto, but this one has the ability, if you look on here, these parts, they can come off based on the depth. As you know, anatomy is a little bit different. These parts are interchangeable. This is just a one-time retraction device. This actually, believe it or not, can come in very different sizes. They can actually come down to pediatrics. And the cutest looking thing you ever seen in your life is a small Finochietto. It's so small. It's also sad because obviously a baby's having an open heart surgery. But just realize the difference of these are the parts on here are interchangeable. They come off based on depth, size of the anatomy itself, but they're both self-retaining retractors. I don't have any examples of these, so I'm showing you some pictures of them. This is what they call an internal mammary retractor device. There's just two continuations of them. Now, what is the mammary? It's the mammary artery. So this is open heart. Now, when you do open heart surgery or bypasses or the cabbage type of surgeries, We're using the saphenous vein typically. Another option is the mammary artery. So mammary artery is an option. That runs parallel, I would say, to the epigastric, but it kind of runs from superior to inferior of your abdomen, maybe perisagittal. So this retractor attaches to your bed and actually holds your body cavity up, your incision up, your mammary artery for the graft, or using that for a bypass. These are self-retaining retractors to access the mammary artery, and this helps with opening that cavity up, and so they can get access to that. Probably the most typical thing used for an open heart surgery for bypasses are saphenous veins, but they can also use the mammary artery, sometimes in conjunction. They could use a little bit of both. Doctor's preference. I thought that was a cool retractor device. Now you know what this is, a sternum needle holder and a wire twister. Why do we need a wire twister? If you're doing open heart surgery and you're making an incision in the sternum and we open that sternum up, we're not using nylon to close that up, right? We need some really tough suture material, and that's going to be some metal, right? Or stainless steel, and wires, right? So you tie them up, and these twist, and you're going to cut them off, and this is a wire twister. So anyone that you see on x-ray that actually has crisscross on their sternum with a bunch of wires is a good indication they had an open heart surgery. And so this is just an example of having this on the field as a wire twister. You need that for open heart type situations to twist those wires. Now I'll jump right over to a good segue is if you're going to twist wires, you need to have the ability to cut that wire, right? A heavy wire cutter. You can't miss that. We won't say too much about that. Open heart, closing up that sternum with wires, stainless steel, I would say 25, 26 gauge. Cut those wires, and then you twist the wires, and then we'll cut them off, right? Going over here, because we kind of jumped all over the place. Now, if we open the access to a thoracotomy and we spread the ribs apart, we get trocars in there, we get that Finochietto in there, we did the surgery. Do you think the ribs are pliable and they're just going to fall back into line? The answer is probably no. Not probably, it is no. So if you look at this, a rib or a Bailey rib contractor. Now if you could just imagine, we put this on one side of the rib and this on the other, and we push it together, we're going to approximate those ribs. Come on, Brad, you can approximate. Trying to do this with one hand. Approximate the ribs. So it's going to close it up. We approximate it. Now we maybe have one or two, one on one side, and then we continue to close with sutures, whatever we try to work on. But trust me, you're not going to be able to hold the ribs together as we're suturing. This device will do that. It will help approximate the ribs as we close the thoracotomy on the side. It's called a Bailey's rib contractor. Now we have a thoracotomy, and this strange looking spatula looking thing, I have no idea how to describe it. If you do a thoracotomy, right, we have an anterior approach, which is underneath the actual breast itself going to the side, or the posterior, which is underneath the scapula. There's two approaches you can take. In this case, we are going to do a posterior approach over the scalp, right underneath the scapula muscle, get access into the ribs. But if you know the actual muscles that lie behind there, around the rotary cuff itself, the subscapularis, the infrascapularis, the tres minor, we need one of those muscles that come across that scapula needs to be retracted back. So this is the Davidson scapula retractor. And actually you push on that muscle and you hold that muscle back. It's designed to come in, retract the muscle back as we do a thoracotomy. It's a strange looking type of actual retraction device. It's a handheld. You really can't miss this. CST exam will ask this a lot. The Davidson scapula retractor. Look at that thing. Crazy. Going down the list here a little bit. If we're making an incision for open heart, the type of incision we do is a medium sternotomy, right down the middle of the sternum. You can use this knife, right? But typically doctors will bow me down until we get to the sternum, and we use this type of saw to access the sternum itself. Now look at the saws. We have oscillating type of saws, which means side to side, or we have reciprocating type of saw, which means back and forth, or sagittal saws, which means kind of at a 90-degree angle. We're looking at a sagittal reciprocal type of saw. It's going back and forth at a 90 degree. It has that perforation which protects it from any damage it might be on. So this saw opens up the sternum, what they call a medium sternotomy. So CST exam questions will say, what type of incision would we do for an open heart surgery? What type of equipment would we use? Medium sternotomy with a sternum saw, right? And that's a sagittal or a reciprocating type of saw. Now we have some good examples of rongeurs, shears, more shears. So we have a good example of a Sauerbruch rongeur, a Stills rib shear, a Gluck rib shear, and a Bethune type of rib shear. Wish I had some examples to show you, but I have pictures here. But give you some examples. We're resecting ribs. No brainer, right? Why are we resecting ribs? Flail types of chest, ribs, fractures, cancer that's spread to the ribs. There's many variables why we're taking those ribs out. But some properties here. If anyone knows what a guillotine is, you know, back in the day we'll cut the head off, right? Back in medieval times, slicing action cuts down. Let's look at two kind of versions of what I call the guillotine action. Very small guillotine action, small ribs. So ribs are in different sizes, right? Some people have large ribs, some have small ribs. You need the tool for that kind of scenario. In this case, this is going to go around the smallest of the ribs and guillotine and cut the ribs that way. Maybe some small types of ribs. Where are they? Maybe around the clavicle itself. There's something called a thoracic outlet syndrome. It's up by you're right above your clavicle in your shoulders. And it usually involves maybe hyperextended your arms too far. You cause some irritation to that brachial plexus nerve that runs in your shoulders. And usually therapy kind of cures that, but if there's impingement on nerves and blood supplies, you need to take that rib out. Maybe that's a good tool for that. This Sauerbruch gets in there and kind of cuts that rib and takes pressure off those nerves. This has a kind of guillotine action too, the Stills. Again, maybe the ribs are a bit larger. So many variables, what they're going to take the ribs off, what ribs, but you can see how progressively gets a little bit larger in sizes of shears itself. Common names you're going to see on CST exam, the Sauerbruch is a rib rongeur. Don't confuse that with typical rongeurs that we reshape bone with. This is a resecting device. We take ribs off. The actual Still is also a shear. It takes ribs, has a guillotine type of action. Now we have a typical type of shear, that kind of a handle activated shear. And as you can see, it gets a little bit more progressively bigger all the way until eventually you have the Bethune. This thing is huge, right? Probably the size of this table, at least halfway. And the common theme progressively gets a little bit larger based on the size of the bone itself. We'll jump over to something called an aortic punch. It's not something you have on the holidays. Sounds delicious though. We're not going to have that. Aortic punch. So if you do a bypass graft on an open heart surgery, so aortic punch, right? And typically used if you're doing a bypass surgery, if you have blockage in your coronary arteries, we have to bypass that. So if you have your saphenous vein, if you're bypassing past the deficit in your coronary arteries, and we have to attach it to a good blood supply like maybe the ascending artery or the arch itself. This gives a more uniform hole per se in the correct diameter that they're going to actually reattach that saphenous vein. So it punches out an actual exact type of hole so they can actually sew the vessels in place. Okay, the aortic punch. It comes in different millimeters and sizes. Now, a suction device typically used in a lot of vascular, say peripheral vascular, pulmonary, open heart. It's called the Pichon, Andrew types of Pichon. And it's kind of a skinnier version of it. If you can look on that. It is attachable. The little part on the top will come off. There's many different types of suction devices, and you probably know the Yankauer, the Fraser, This is called the angiopichon, and they use it a lot of the times in vascular, open heart, and pulmonary surgery. Okay, the DeBakey cortication clamp. What is that? We have the cortication clamp. What is a cortication? That really probably would give you a good idea what this tool is used for. Cortication is a stenosis or a congenital problem, a narrowing within the aortic. It is the thoracic aortic, where it's narrowed. It's a congenital problem. That's something that you can't, I guess you can live with over time, but it will become problematic. So either they endovascular, put a graft in to dilate that stenosis, but if we're resecting out and putting the graft in, this cortication clamp is a good example of where they will clamp off on both sides, resect what they have to, and then reconnect with a graft where their problem is. But the cortication just means stenosis or abnormal stenosis within the aortic area. Okay, cortication clamp or DeBakey. Now this device I won't go over too much, but in pulmonary surgery, they use this a lot. Why are we using that? A pneumothorax, something called a pneumothorax. That is an interruption in the pleural cavity, which is, your lungs sit within those pleural cavity and they're controlled by something called a negative pressure. Looking at this is called a underwater, they call it a dry suction water seal drain. They call it a chest drain or underwater drain. Why do they call it an underwater drain? They do have a section in here where you put water, and it will let you know by bubbles if it's your pleural cavity, if there's air still entrapped in there, because this is going to reestablish the negative pressure if you're having something called a pneumothorax. Tension pneumothorax, hemothorax, typically any of those is problematic. We have to reestablish the negative pressure because that's where your lungs are controlled, otherwise they will collapse. This does a little bit of those three things. What's the three things that this device does? This chest drain or underwater seal drain reestablishes your negative pressure, sucks out probably blood, pus, any kind of liquid, a combination of all three of those, right? Kind of a pro tip, this needs to be below the patient's level because we don't want backflow into the patient itself because that can be problematic, right? Has a suction device that's attached to it. So, like I said, it reestablishes your negative pressure, but also irrigates or aspirates anything that's accumulated within that chest cavity. We don't want excess of air in there. We don't want blood to accumulate. We don't want pus or anything like that, okay? Reestablishes your negative pressure with a chest drain. Now, that's just an example of some pulmonary thoracic. I know there's a lot more out there, and I'm pretty sure people that are specialized in this field probably want to add a little bit more to that. Hey, if you see anything, if you're in this field, if you want to add some comments to it, hey, some questions, correct where I'm wrong, I'm all for that, really. But this is just a good example for people that are students in my class. There will be a test on one, what it looks like, a generalized example, what it's used for, because it's all about exposure to what those instruments are. Over time, you will become more proficient in it. You will become an expert at it. Right now, in this video, it's just about being exposed to these instruments. Pulmonary, thoracic, cardiac type of surgery. All right, I thank you, and hey, add some comments to it, like this video, share the video, and I thank you for spending some time and watching this. See you next time.